Welcome to our Facebook Live, where UC Davis health experts provide information that you want to know. I'm Marianne Sharp. Today, we're talking about autism, one of the many neurodevelopmental conditions that the UC Davis Mind Institute specializes in, from research to treatment. It's Autism Awareness and Acceptance Month, and many aspects of autism diagnosis and care have changed over the past year due to the pandemic. We'll be talking about that and much more with our two guests. Dr. Aubyn Stahmer is a psychologist at the Mind Institute and a professor in the Department of Psychiatry and Behavioral Sciences. Her research focuses on helping people in the community access the most high-quality treatments. Dr. Sarah Dufek is a psychologist at the Mind Institute as well and an assistant professor of clinical psychology in the Department of Psychiatry and Behavioral Sciences. She is an expert in the assessment and treatment of autism across the lifespan in the clinical and research context. Thank you both for being with us today.
Good to be here.
If you have questions, please feel free to post them in the comments and we will answer those before the end of the discussion. So let's start by defining autism spectrum disorder. Dr. Stahmer, what is autism and how prevalent is it today?
Thanks, Marianne. Well, autism, as you said, is a neurodevelopmental disorder, which means it is a difference in brain development that we can usually see very early in childhood. And it's called autism or autism spectrum disorder, sometimes ASD. And now sometimes autism spectrum condition is another name for it. So you can hear it called many different things. And it impacts social communication, and that's like nonverbal communication, pointing, eye contact, as well as speech and language might be different in children who have autism. And social interaction, so how kids are using communication to talk with each other in social situations. Then the other characteristics called restrictive and repetitive behaviors. And those are things like special interests, maybe a special interest in dinosaurs or a special interest in train schedules, or motor mannerisms such as hand flapping or insistence on a particular routine or difficulty with transitions. And so it's really a spectrum where children and adults with autism have a wide range of differences in their use of communication and the impact of these behaviors on their daily life, from being great conversationalists to needing alternative forms of communication like pictures. Autism occurs in all racial, ethnic, and socioeconomic groups, and the CDC reports that the rate right now is about 1 in 54 children in the United States who've been identified as autistic. And as I said, we were talking about autism generally, but autistic people are very different from each other, just like you and I are. And some may need a lot of support in their daily lives and others need less.
That must make evaluating and diagnosing it a little more complex. Dr. Dufek, could you talk about how we go about this process of evaluating and diagnosing autism?
Absolutely. So the diagnostic process usually starts when a parent or their caregiver starts to become concerned about their child's development, or even a person themselves start to think, maybe I have autism, and are seeking an evaluation. So because there's no blood test for autism, really, we have to rely on information about behaviors and experiences instead, the person. And the diagnostic process has to be very comprehensive and cover all areas of the person's development and behavior. And it can be really complicated, as Dr. Stahmer just described. Autistic people are often very different from each other, and the characteristics of autism, even in the same person, can really change over time depending on age. So we often approach the diagnostic process as an investigation, where we really gather all the evidence we can about the person's developmental history and current lives in order to see if these criteria for autism that we all agreed on apply. In order to do that, we need to get information from other people that the person knows. Usually this is parents or teachers in the case of children, and or spouses in the cases of adults or friends. And then we always make sure to engage the person themselves. So that way that person can tell us themselves about their experience, or if they're very young or minimally verbal, for example, we just play together, spend some time together, so we can see how the person prefers to interact and get kind of a clearer picture. We also have some great standardized tools for this to help us do this. And then once we have all the information regarding history and current behavior, then we apply these diagnostic criteria and see if there's a match. But this process really takes quite a bit of time, as you can imagine. It requires a lot of skill, real skills on the part of the diagnostician, because the diagnostician really needs to know a lot about autism and have a lot of experience with autism and what it looks like in others. But also they need to know a lot about like variability in usual development and other conditions that may look like autism at first, but are not. So it can be complicated.
And it would seem that the pandemic may have complicated things so much more, the need to wear masks, the pivot to telehealth, all of these things must have made the process even more complicated. This is maybe a question for both of you. How has this process evolved and changed due to the pandemic, and what sort of workarounds are there at this point?
So the pandemic has really, yes, thrown a wrench in our usual diagnostic process, in that we're not really able to do the activities we would like to do in order to get the clearest picture. So we have lots of great ways to get information from families, and we can do that over telehealth quite easily, but the actual interacting and doing activities together can be harder. And the mask and mask requirements and need for social distancing and make this quite challenging. Like, for example, to engage a child in order to get information. The diagnostic process for autism really requires so much creating social situations and rapport in a natural way so that you can get information. And because we're really looking for behaviors related to these diagnostic criteria, like social communication skills, like facial expressions, or integration of eye contact, gestures, reciprocal social interaction, or like play, in order to really help us apply this diagnostic criteria, or even the way the child or the person plays, interacts with toys or objects. And we really want to see that kind of in a natural way. And this process was already challenging even before the pandemic, and we just don't know now, even when we do our usual stuff, how that would be affected by the masking and social distancing requirements. We do have some great new tools for this, though. Necessity is the mother of invention, right? So we have very quickly, people were already developing some nice telehealth tools because there are a lot of benefits of telehealth. But they sort of sped up that process in terms of the pandemic. And so like, for example, in young children, we have a couple of new measures that we're using and other folks are using. One's called the BOSA and one is the Tele-ASD Peds. And we use these, one's for young children and one covers young children and then across the age. And in those measures, since they're done over telehealth, we basically have a caregiver of someone who knows the child or adult very well do a lot of the activities in person that we would have done instead. And this actually, we've found, has given us some great information in a way that we didn't expect that can give us a lot of diagnostic clarity. And it works pretty well, especially in the clinical setting where we really didn't want families to have to wait a long time to get a diagnosis, mostly because not having a diagnosis keeps you from getting access to appropriate treatment services. So we found that we actually can use a lot of these measures where we have the caregiver doing things to get a lot of information. And it's actually been a nice bonus for us because we get to do these behavioral observations in the home instead of having the parent and family come to having everybody come to the clinic. So it's more natural, and you get to see the child interacting in their environment and with the people around them. And so that gives us a lot of great information for diagnostic purposes. Like I said, we haven't really been able to test it as much as we like, which we're kind of doing ongoing testing now. But the other purpose of diagnostic evaluation too is to come up with treatment recommendations. And so doing it in this more natural way helps us to make more family-centered recommendations, which has been great.
It's an interesting irony that the technology of doing it virtually has actually made it a more natural setting. Right? I
think so. And at the Mind, we're doing some of this work with, we're currently testing a new tool in a study called the TEDdy study. And this was a telehealth assessment that was actually totally designed pre-pandemic, based on the need of assessing infants who the parents noticed early red flags. And telehealth just really lend to that because we want to do a lot of things with the caregiver because it's more developmentally appropriate. And so for that study, the parents were concerned about their infant between 6 and 12 months they just would refer to the mind, and then we've been tracking them over time. And we had already started that even before this, but it does lend a nice, we're able to kind of offer that as like a way to sort of track babies over time to see. And then, our next step with that is to really compare this telehealth version with the in-person version and see, are we getting the same amount of information? Do we feel like this is just as effective, or do we really need to see families in person? Because as you can imagine, traveling with an infant is not easy. So.
No, and in fact, I believe we're still recruiting for the TEDdy study, so we could probably put that link in the comments if anyone is interested in the TEDdy study. Dr. Stahmer, the pandemic has been really tough for autistic individuals, especially those who rely on services or programs or therapies, and many of those were, at least at some point over the last year, canceled, especially the ones that were through school systems. I'm curious how the pandemic has changed the way that therapy is delivered and what impact you've heard from families.
Yeah, it's been really a quick shift for schools and therapists, and some of that, similar to diagnosis, right, has been really eye-opening, and some has been very challenging. So for our early intervention, our more intensive early intervention, we quickly moved parent coaching to telehealth, which actually works wonderfully because, again, you're in a natural environment. That it's harder for the therapist to sort of take over and work with the child. And we've had fewer cancellations. I think it's easier for parents to do it via telehealth. And so as long as they have a pretty good Wi-Fi connection, or we can send a hotspot, then it works very nicely over telehealth. And we may end up continuing that as we go on. Now, for little 2-year-olds who we're doing intervention with, it's a little more challenging, and for kids who are in school trying to do that over telehealth. And so it really varies sort of how successful that is with the child's interest in the activity, their interest in the computer. And so I really think it takes a lot more parent support to do what before would have been something the teacher was doing or the therapist was doing that might have given the parent a break, especially in households where you've got multiple kids and multiple people trying to work from home. You can imagine that it's challenging. But I think it's given teachers a chance to partner with parents a little more and see how kids are in the home. It's given parents an opportunity to see what their kids are doing in school. They probably would have seen enough after a month, maybe after a year. It's a little too much. But it has been beneficial for some aspects of training. We've been able to do lots of services this way in terms of mental health services work really well over telehealth. We've even been able to do some social skills programs this way. And Sarah, maybe you want to talk about, so she's been working with Dr. Megan Talbot on the TEDdy study, which then of course identifies kids who might have a high likelihood of having social communication challenges. So then what do you do in terms of treatment? And so Sarah, do you want to talk about Telebaby?
Sure. So then as an accompaniment to the TEDdy study going on, where we're looking at assessment over telehealth, then we had this need for a treatment, right? So if we document these concerns and the parent says, well, now what do I do? We've used these caregiver coaching strategies for a long time in person, but they rarely lend really well to telehealth because, we're just coaching the parent through these strategies with their child. So we did that for a set of infants who were identified through this TEDdy assessment. And we found it was really successful with parents learning these strategies and feeling very supported over that time. We asked them in interviews, obviously, afterwards to get some information. And the way it kind of works, just to give you a picture of it, is like, let's say the parent comes in and they're concerned that, my baby's just not, orienting to me as much as I imagine. Like they're not looking at me doing things. They're not, looking at my face very much, or, sort of orienting to what I'm doing. And the concern there is that if the baby's not necessarily attending to their parent or caregiver as much, they may not be learning things that the parent's trying to teach them, early on in this early phase of development. So we have these strategies that we find often work for that. So I'll say, oh, okay, I hear that, you want your baby to look more when you're trying to get their attention. So let's use a strategy called imitation. And so one strategy we found that really helps for that is like, if the parent just starts imitating everything the baby does. I know it sounds a little bit oversimplified, but we found it's really works when you just, you imitate facial expressions, sounds the baby's making, actions they're doing on objects, unexpected events that happen as you move through the day. And we notice that the babies will suddenly start looking more like, what are you doing over there? You're doing what I'm doing. And it's surprisingly effective. So, what we'll do is we'll just like introduce the topic. Parent tells us the concern. We say, hey, do you want to try this? And the parent says, yeah, let's try it. And we have the parent do it and we coach them through it. The coaching the parents really like because it's like real world sort of application in their own routines. And it really helps. And then we come up with, and then at the end we say, how'd that go? And then they can tell us like, oh yeah, I liked that, or I didn't like that, or, maybe, and then we help them come up with ideas. We kind of collaborate together. Like, when would you like to use this? And then the parent will give us examples. And we say, okay, let's try it. And then let's report back next session. And then they'll come back and say, yeah, that went well, or it didn't go well. And so the coaching process really is a really nice collaborative approach. And I think, as Dr. Stahmer mentioned, like before, when we're in person, there's a tendency as a clinician, I think, to be kind of interfering in that relationship between, because you want to play with the cute baby, right? When you're there. So, telehealth kind of forces you to take a back seat to their interaction while simultaneously being supportive and available to the family. It's just
yeah, the parental involvement sounds awesome. And in fact, that example you gave is just perfect and great insight to something that seems simple but is so effective. In general, Dr. Stahmer, what can parents with autistic children do to help support, these distance therapies and also, of course, distance learning? Although some are going back in person, there's still some people doing distance learning. It's been tough.
Yeah, it has. And I think we all thought we'd be back by now, but I think it's really an opportunity for parents to partner with their providers and teachers. And it's a different way of interacting for teachers too. They're used to having their classroom and they do their excellent teaching, and this is really different. And so I would encourage parents to really work with their teacher to figure out what's working well for their child and what's not. Remembering that the teacher is learning how to do this kind of while they're doing it, and that they've got lots of other kids in their classroom as well. But I think that partnership's important. And some simple things like having a consistent place that counts as school, and having a schedule of when you're going to school, actually getting dressed and having your breakfast, and then having it be as typical as possible without a phone or, TV on. Again, this is going to be simpler in households that have one child and not a lot of people doing things at the same time. But even, a spot on the bed or the end of the couch, if it's consistent, I think that can be very helpful to get kids engaged in what they're doing. And, lots of breaks and things like that. We actually, last summer, when we thought we'd be back in school last September, some of the psychologists at the Mind did a wonderful webinar about how to prepare to go back to school and how to reduce anxiety around that. Because some kids with autism may really like the interaction that is a little safer to do it over Zoom. And so I would encourage you, maybe we can stick that in the chat as well. It's on the Mind YouTube channel. So that might be something to watch if your schools are starting to go back in session.
Yes, that was the Minds Behind the Mind that you're talking about. Yeah, if we can put that in the comments, we will. That's a great example. There were so many good, really real world, I thought, tips in that. I'm curious, Dr. Dufek, I know we're still in it in terms of the pandemic, but things are changing with the vaccines and everything. I'm wondering though, if you can kind of look back and say, what were some of the most beneficial lessons that we've learned over this past year in terms of access to assessment and treatment for autism?
So I think what this has done is the pandemic has really created a more realistic situation for telehealth. This technology's been around for a while, but I think, having a situation where we all at the same time had to make this quick shift in lots of different areas like education and health, the healthcare system, and even in our own personal lives, interacting with our family that we couldn't see. I'm noticing I kind of had the benefit of being pre-pandemic into pandemic, and people are much more comfortable with scheduling things over telehealth and it just took a lot of experience. And I really don't think that would have happened, if the pandemic hadn't happened, so I think the other thing that's happened too is, even, we have this technology, but I think there's been a lot of also creative additions to it. So because, everyone's doing it at the same time and we all have this collective experience around how great telehealth can be, I'm seeing like more and more creative improvements every day. And I think that that really helps, just different little aspects. Even, every new Zoom update, we get new fun things to do over Zoom or new ideas about how to communicate with each other. So, and I think that, the real benefit that we're hoping to see, and that I think it really has for us, is that we are going to be able to access folks who have been traditionally, historically underrepresented in clinical and research contexts that we just couldn't get to before, because of the benefits of telehealth and how, present it is now in our lives, and we're comfortable with it. So that's really exciting.
Yeah, that actually ties beautifully into the next question I was going to ask, which was, how has the pandemic affected the way that families participate in research and clinical services at the Mind Institute? And can families still participate? Obviously, we're still doing research.
We
And this
are.
could be for either one.
It's been really interesting. We've put all of our programs, really everything we've had, is now available virtually. And so we've had huge increases in our attendance at things like Minds Behind the Mind and our parent groups, from people who live in rural areas of Northern California and places that historically haven't been able to come to the Mind. So that's been wonderful. And we hope we can extend that and keep figuring out how to do some kind of hybrid so we can reach more people. Our social skills groups, our Access, which is like a job coaching program, all of that, our sibling support groups are available online until we come back. We are currently opening up a little more research time and clinic time. So some kids can come in, and adults, if they can be masked, if, meet certain criteria so that everyone is very safe. And I think things will hopefully start opening up sooner, but most of our studies have transitioned, and our clinical programs, so that at least part of the participation can be done via telehealth, and then a little bit in person as well, as people feel comfortable.
And we can also, I think, put links to Access and some of the support groups as well in the comments. We are talking about autism today, particularly how the diagnosis and treatment have evolved by necessity due to the pandemic. And we're talking with Dr. Aubyn Stahmer and Dr. Sarah Dufek. They are both Mind Institute faculty members and autism experts. Looks like we have a couple of questions, and we will be getting to those at the end of our discussion. If you have one that is not in there yet, please post it in the comments now and we will answer it. All right, I did want to talk about the fact that it is Autism Awareness and Acceptance Month, and it's an opportunity to work toward greater acceptance, understanding, and inclusion for all people on the autism spectrum. So let's start with how is the work of the Mind Institute contributing to this? And this is a good one for both of you.
Yeah, I've really enjoyed seeing the Mind Institute kind of grow and change in this area. It was started by families at a time when not many people knew what autism was. And so awareness was a really big deal to try to find kids who had autism and adults. But now people are pretty aware. And as we learn more about neurodiversity and differences in the way people think and hear more from autistic adults, we've really shifted our focus from finding a cure for autism to accepting and celebrating the differences in the way people's minds work, right? And how incredible everyone is, and the diversity of different brains is really important for our society. So thinking about acceptance is really about how we as people can aim to better understand diversity and inclusion, how we can support schools in supporting kids in all their usual settings, how we can understand in social situations that eye contact may bother someone with autism, and so we shouldn't expect that of them for this to be a great interaction. We can interact with people people who aren't autistic can learn to understand how to accept those differences as unique and usual, right? And so the Mind has really been working toward more actively involving autistic adults in helping develop our research strategies and mission and clinical and scientific goals to understand what's important to them, and to make sure our work is relevant, and that our intervention and treatment studies are really about addressing challenges and providing supports. I don't know, Sarah, if there are other things. I talked a long time.
Sounds good.
Okay, well, the next question then that is natural is how can people, all of us, be involved in supporting autism acceptance, which is so important?
So we're so lucky in that. I mean, don't you think, Aubyn, there's just been a proliferation of information online and books and movies and music and all kinds of things related to autism now that's available. I remember, even not that too long ago, when I was doing a diagnostic evaluation and a parent, I was saying, I think it sounds like your little guy has autism, and we're gonna, I'll try to, and the parent would often look at me and say, I don't even know what that means. Nowadays, usually parents do know. And if they don't know, then I have so much available to me now, that just description of autism, and that I didn't have before, especially this piece about how different folks are from each other. So it's very hard to, express to a parent what they need to expect and what kind of supports and services they might need, but now there's a lot of information out there to help us do that. And in terms of getting involved and supporting autism acceptance, because we have a lot of great information and knowledge out there, it really helps to learn more just about neurodiversity in general too, and really get perspectives from autistic people themselves. That really helps in the level of understanding. And then the more people you have access to, the more you can get sort of a clearer picture of what's all involved. And something we've really been thinking about lately is how folks can get access to people who use alternative forms of communication. So sometimes in autism, many people are minimally verbal, or they're not necessarily using verbal words to communicate. They use alternative forms of communication, and that can be confusing for people who don't have experience with that or know how that system works. And so I think educating yourself about that and what it's like and what it looks like really helps. That we have a lot of great events at the Mind and other organizations here in Sacramento, and now everything's online, so you can do a lot of different things all over the country and internationally to talk and teach you more about autism. And then I think for the families themselves, I think as a parent or an autistic person themselves, it can really help to know your own rights and options for services and advocacy locally and even nationally, because I think that piece is very, very important too. And we can all take steps to support policy that are good for people with autism.
Great advice. Dr. Stahmer, anything to add on that one?
No, that was wonderful.
All right, well, we do have some questions from viewers, so let's get right to them. The first one is actually a multi-part question, and since the first part is a big one, I'm going to just start with part of it, which is, have you figured out what causes autism? Why or why not? That's a tough one.
It's a really good question. I'll try it, Sarah, and then you can disagree or agree. I think part of the challenge with autism is we've talked about the diversity in people with autism, and it's likely that there are autisms that we just don't understand yet. And so there are likely multiple causes of autism, likely some genetic causes or genetic and environmental interactions that are causing autism in multiple different ways. So each time we find a gene or set of genes that we think has a role in autism, it has a role in a small portion of people with autism. And that's challenging, and it's going to take many, many people working on this project. And that's why programs like our Spark project, where they're collecting lots of information from families across the country, and we're one site of that, so that big data can help us figure this out. I don't know, Sarah, if you have other thoughts on that. It's a challenging one.
No, I agree. I think the only thing I would add is I think, we talked so much about how much information is out there, which has been so great, but sometimes there's information out there that can be quite misleading. So I think because we want so badly for there to be an answer for everything, it's just a human condition. There is a lot of misinformation out there about what causes autism, even in community providers sometimes. So I think that the only thing I would add to Aubyn's great description is that we really don't know, is that we really don't know. So I think sometimes people want to, guess, or they just want to put the issue to bed sometimes, I think, and that can lead to a lot of misinformation out there about what causes autism. It's really still to be determined. We just don't know.
Yeah, one of the many things that the Mind Institute is researching and looking for answers about. The next part of this question is it concerning that the prevalence of autism is rising?
Go ahead, Sarah.
It's a good question. So we don't truly understand the prevalence rising situation, except for maybe there could probably is multiple factors to it. So we changed our diagnostic criteria, so we're including more of a spectrum now, like Dr. Stahmer described. So that includes folks who may not have been incorporated in, how I talked about that process of applying these diagnostic criteria. So either sometimes we find that those folks either got another diagnosis of something else or just were missed altogether, or, just didn't qualify for services based on they're just not matching this presentation. So we think some of that increase is related to that. Some of the increase also could be related to the fact that we're just more aware of autism now. So people are more aware of it. They, oftentimes when I do a diagnostic evaluation for a very young child, we'll talk about autism at the beginning and the parent will say, I don't have any autism in my family. But then as we get, into the questions and they're like, I'm thinking about my grandfather now, or I'm thinking about my mom's brother, or my sister, So I think that, we're just more aware. I think there are a lot of folks with autism walking around in the world who don't even know that they might meet diagnostic criteria because of the nature of the condition itself. So I think those things working together have led to this increase. But I do feel that there is statistically, though, even when they account for that, there has been a rise and increase in just the number and the prevalence of cases, even in addition to those factors. And so we're just actively trying to determine what is driving that. And again, this is just a question that we just don't know.
Okay, the next question is, it's a little long, so I'm going to paraphrase a little. It's a parent who's in a tough situation. Their son is 12 and as big as me. He was diagnosed at 2 with autism, and this parent is worried about major explosive behaviors and anger, and even being attacked by the son. They're worried that there is no support as a caregiver. So what can a parent do when doctors, social services, police, et cetera, cannot offer anything additional? So they're sort of at a loss. Do we have anything we can recommend in this situation?
Well, it's really challenging. And so I don't want to try to recommend something specific to this child and family, not knowing the context. I would recommend contacting the regional center in your area and really working with your service coordinator. And if that hasn't worked well, thinking about contacting an organization like Disability Rights California to help support advocating for additional services, either through the regional center or the school or insurance, to support you with those behavioral challenges, because there are behavior specialists that should be able to help with that. And it's a matter of figuring out how that can be funded and supported. So I would go on those routes. I don't have it. There is not an easy answer for it, though. It's really challenging when you have these explosive behaviors. And then that it's a behavior specialist can help think through what the child might be communicating with those behaviors, and whether there are sensory factors that might relate to it as well.
Yeah, definitely.
And also too, I could add to that what I think also from being, I love Aubyn's answer because that's exactly what I would have said. And but I also think what's great about the Mind is we're in this multidisciplinary sort of setting too. And I subsequently also added to it that sometimes we can find medical explanations that we didn't really anticipate were factors. So going back to the pediatrician or the child 12 years old, so pediatrician, or even this often pops up in adults too. And so going back to whoever is that medical home for that child and really making sure they're doing a very good workup. Because I think a lot of the time, we sort of practitioners, especially if they don't know a lot about autism, will sort of assume that these behaviors are part of their autism, and they don't really look as close as they should at things like medical or sleep apnea, or things that may be impacting these explosive behaviors, especially if they're relatively new. Although we do kind of expect around puberty for those behaviors to pop up sometimes. So. But a good medical workup can really help think it through a little bit better, and then maybe some referrals to more specialists related to that.
Okay, great advice. We actually have quite a few more questions. Here's another one. When would a child with autism start to show repetitive behaviors?
Go ahead, Sarah.
I probably have opinions about that. So I think that the short answer is that they can. So we tend to think of autism itself as the characteristics of autism will show up in childhood, and that early childhood usually we tend to think of that as in school, young child, like birth to elementary school. We tend to see these behaviors. Repetitive behaviors can pop up really young. Sometimes we see, infants starting to do some repetitive behavior. It's tricky though, right? Because babies and toddlers do repetitive behaviors. A lot of the time it's just part of natural development. So, because it's fun to do the same thing over and over. Every parent's experienced that, like dropping something from the high chair, like, oh, that's a fun game. Or, but there are particular ones, especially like if we look at some of the work by some of our colleagues at the Mind early on, we can see sometimes that babies who ultimately develop ASD sometimes are showing more of these RRBs very early. But then, from that work, we also know that sometimes babies show those and it doesn't mean anything. It's not indicative of of autism spectrum disorder at all. So it's really hard actually to hinge the predictive diagnosis on one thing or the other. But basically, we can see them pretty early on. And then sometimes kids will not show any obvious restricted repetitive behaviors up until about, between 2 and 3 years old. Suddenly we start to see more of them. So there does seem to be kind of a times where they kind of pop up more. And then I would say the only other thing I would say too is about RRBs is sometimes depending on the person, they can be missed sometimes. So like, for example, like we know that girls sometimes tend to show some special interests that for clinicians, they don't necessarily think that they're intense enough to be counted here, because a lot of our diagnostic measures were calibrated on boys because it's more common in boys in terms of right now, in terms of prevalence. And so, I think it's just important to think about the child, think about their behavior, think about where it would count here or there. And again, it really takes a diagnostician who knows a lot about autism there, but those RRBs can pop up at any time. We tend to past the early childhood time, RRBs can pop up that are not necessarily autism related, if that makes sense. You need both the social communication and the RRBs together in order to come together for autism.
Okay, makes sense. We have time for just a couple more questions. If we don't get to your question, we will try and answer it in the comments afterward. This person is asking whether the Mind Institute offers a program for the diagnoses that include genetic testing and brain scans, and whether that's the type of testing they should seek out. Of course, we don't know the specific situation, but can we talk about maybe what we do offer in terms of that kind of testing?
That's a good question. We do have pediatric genetics at the Mind Institute, and if there are concerns, I think most of our diagnosticians, Sarah, correct me if I'm wrong, would recommend a genetic workup for the patients that come into the Mind Institute. I think that a brain scan is less often recommended very routinely, but many of our research studies actually include those. And so that's a nice way to get one if you think there's a concern. But I think it's less often that we find something specific from a brain scan. Would you agree, Sarah?
Yeah, I would agree. And one thing we kind of touched on but didn't mention, but autism itself often runs with a lot of comorbid medical conditions or other, things. It's not comorbid, basically means that those two tends to run together with other conditions that folks can have. So, for example, like kids are just more likely to have a seizure disorder, for example, or something like that. So, doing the genetic workup and then maybe being seen by a neurologist if you have any concerns about neurology related neurological related conditions is always sort of good practice we would recommend just to make sure. But then again, like Aubyn said, we don't necessarily find a lot of things on brain scans necessarily, so we don't want to put the family through all of that if we're not on the clinical side, if we're not concerned. But it always helps to have I think in autism, a good medical workup because there's a lot of co-occurring conditions and just medical things that can really impact behavior and make trouble for the family.
Yeah. Here's another good one. Is the Mind Institute open to anyone who has been diagnosed with autism? They're asking about a 3-year-old, but it's a good question. Anyone want to take that?
So the Mind Institute, is open to everyone. The services and things we have, we're a small clinic, are somewhat limited. And so it depends on whether UC Davis takes your insurance is one thing, or some programs are free of charge. And some programs, sometimes you can get services, diagnostic or treatment through our research studies. So it's always nice to sign up for our research registry. And then if your child meets criteria, they would call and recommend you. So I'd recommend signing up for that. It's on our website, and then just looking through what our clinic has to offer and see if any of those things are appropriate for your child. So it's really variable.
And we have open houses too now virtually. So
That's right.
Open house is a nice way, I think, to figure out if you individually could maybe benefit from some services at the Mind. And things are always changing. So even if you go to one, it doesn't hurt to revisit it, I think. Don't you think, Aubyn? There's always new stuff happening.
Yeah, and we do have a resource center, and it's physically closed right now, but you can access support from our family navigators and people who can help with resources through the resource center.
And we actually very recently, just last weekend, had a virtual open house, and we can post that in the comments too, because it's on our YouTube channel. You can watch the whole thing, including a Q&A session at the end with the director of the Mind Institute, Leonard Abaduto. So it's a great resource. I have a quick follow-up, and this will be our last question for now. Is there anyone at the Mind Institute who has a focus on missed or late diagnosis of an autistic adult woman? So in other words, how about adults? That's the question.
We do have a couple of diagnosticians who work with adults at the Mind, and so it is an option for people to come and get a workup.
Okay, great. All right, if there are any additional questions, which I think there may be, our experts will try their best to answer those in the comments for you. I want to thank everyone for all of the great questions and the engagement. This will be available, of course, on Facebook for a while, and then we'll also put it on our YouTube channel, so you can always find it if there's something that you missed. And thank you all for being with us today. We appreciate your time. Thank you for joining us for this UC Davis Health Facebook Live. Again, if you have additional questions or comments, you can still post them and we'll try to answer them. And we encourage you to please share this post if you have any friends or family members who you think would be interested in watching it. Thank you for joining us.